Thank you all for being here. In a few weeks, some of you will start receiving mailings from a variety of charities asking you for Christmas donations. And you'll begin to see photographs like this or similar to this. And you'll ask yourself, haven't I seen this before and contributed? Where did the billions of dollars go? Where did the billions of dollars go? It would be fair to say that many of us feel that we haven't got a very good return on our investment. Would you agree with that? How many of you would agree with that? When asked about where he thought the money went, Peter Adamson, who wrote several of UNICEF's State of the World's Children's reports and followed by The Progress of Nations, said 25% went towards administration. 25% was lost in corruption. 25% went to surtaxes, oil crisis, financial crisis, wars, increase in food prices. And much of the final 25% went to some of the most ill-conceived projects you could ever think about. Okay? So that's where the money went. Some of us can quibble about the numbers over here, but it would be fair to say that something is very wrong in the way that we manage preventable causes and the hunger, the malnutrition, and the misery that is all around us. However, the uncomfortable reality is that we live in a world where there's a silent emergency happening every day. 1,000 women die from pregnancy-related causes every day. 22,000 of our children die every day from preventable causes. I mean, that's a 2010 earthquake or a 2004 Asian tsunami every 10 days. "55 jumbo jets crashing every day. 55. More than 2 every hour. This year, 4 million newborns worldwide will die in the first month of life. 4 million in the first month of life. So you might think I'm trying to add depression to the list of problems. Okay? And you could use some good news right now, yes? Yes. Yes. And there's lots of good news, okay? In the last 20 years, we've made great progress, great progress. Child mortality has dropped by 30% in the last 20 years. Pregnancy-related maternal mortality has dropped also by 30%. Millions have been lifted from poverty. Okay? So, one set of numbers. Another set of numbers, hundreds, if not thousands of excellent projects are being conducted and implemented in rural and village situations worldwide. Some serve a village, a group of villages, a town, a city, maybe even a district. So there is good news, even if it's not reported. Eh? And you know, yet few projects ever get beyond that, ever implemented statewide, and even fewer countrywide. Why is that? Why is that? A key factor is capacity building and scaling up. This is critical, as you all know, but also extremely difficult to do. Take India, for example, where I recently spent 2 years prior to returning back to Hong Kong. India has 680,000 villages. Okay? And together with the complexities and the bureaucracy in the state and local governments, okay, development work out there is extremely difficult. So let's turn to the good news and the positive message, because my message to you today is a positive one, most certainly. How can we build capacity and scale up, especially in the field of health education, which is where I've spent most of the last 10 years? How can we leapfrog some of the familiar roadblocks that we've experienced in the last few years? How can we reach those who only seem to be reached by photographers, but never by aid and never by life-saving solutions? So how do we build capacity and reach the right scale? Health education is like a waterfall. It flows downwards. Today, most health education is either on the internet or in printed matter. And the internet is being increasingly used to build this capacity and reach new places. But the internet requires access. The internet requires an internet connection, a telephone line, a computer, electricity, and most importantly, the ability to read. Without an internet connection and a computer, one can access, without an internet connection and a telephone line, one can access information on a hard drive, or on a CD, or on a DVD, removable media. You take away the computer, and then you have electricity. So you have the radio and TV that you can use, but you have to be able to afford it. Take away electricity, and you're left with printed matter, newspapers, and other printed material, but they're not much use to you if you're illiterate. If you're illiterate, you're at the base of the pyramid, okay? And you're the one who needs the information the most. Your only source of information is probably going to be the people around you, who in most cases are also illiterate. 30% of Indian adults are illiterate. But there's good news there too. 30 years ago, that was 60%. Okay. So for many of those who are illiterate, the only health information they probably ever received was for an hour or so on an extremely busy day of chores under a banyan tree from a health worker, together with a couple of dozen other women. On a very rushed day, sit down there, get some information, rush off back to work, rush off back home, change clothes, go back to work, and attend to your daily chores back again. They were never given any reference material to take back, and they couldn't take notes. They don't know how to write. Then when the child gets sick at 3 o'clock in the morning, how do they deal with that situation? How do they? She can't call 911. There's no ambulance service available. Is it realistic to expect them to remember at that point in time what she learned under that banyan tree some morning for a little bit of time? Is that reasonable? I don't think so. No? What I'm convinced we need to think about, and I say we, all of us who care about children and the world and what it's going to look like, is how we can deliver health education directly, okay, to the families and communities, right to those who need it, where they are, as they are today. Health education has got to be one of the most effective ways to reduce maternal and child mortality. These preventable deaths that we never seem to be able to prevent. With education, a girl gets married later, has fewer children, okay, and times the birth of her children. Educating a girl before her teens, as Brett told you, is proved to be extremely effective. Probably the best investment that we can make. And it's clear when children live a full, healthy life, their parents have fewer children. There's a shift from the quantity of death to the quality of life. There are now innovative ways to communicate, educate, and empower, and bridge that digital divide. That last mile that makes thousands of miles of difference. There are smarter and better ways to spend our development dollars as well. We live in iPod, iTunes, iPhone times. It's truly exciting for all of us. I am, like many, many, many others, convinced that the cell phone and the mobile is going to make a big difference. The growth, the acceptance, and the use of it is demonstrating it so clearly for us. But technology has made connection possible in ways that were never possible before. It has stoked the desire of people to be connected now. Take India, for example, 1.17 billion population. Today's wireless base, 700 million, growing at the rate of between 15 and 20 million every month. Wow. Phone penetration will be 97%. 97% by 2014, not so far away, according to a recent study. Soon everybody will have one. And yes, the mobile phone really has connected people like never before. In India, it has united more people than cricket. And those of you who know India know what I mean. So, if you look at the mobile phone technology, and I'm in development, okay? What a wonderful gift we've been given. We didn't invest anything in it. Eh? We, the development. You look at the hardware, the software, the technology, the networks, the switches. We've been gifted with this totally delivery mechanism. It's a game changer for capacity building and scaling up. I'd like to leave you with this. A child dies every 4 seconds from preventable causes. That is now, 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 and now. 22,000 times a day, every day. And the sadness and sorrow that is caused by the death of the child is felt by the mother, the father, the brother, the sister, the uncles, the aunts, the neighbors, and the family forever. And it casts a shadow in their life. That shadow multiplied across districts and cities and countries even. Makes one feel that the sun only shines in some parts of the world. While I have been here, 275 of our children have died from preventable causes. Each one of them had a name and a personality, a family and a future. Their deaths were preventable. They're no longer acceptable. And we will change this, and I ask you to join us. Thank you.